Well, we're here at Indiana Physical Therapy. I'm with one of the owners, Andy Vogel, and we're talking about something that everybody has, I think, at some point, low back pain. How common is it?
Very common. I don't know the exact statistics, but at one point in a person's life, they're probably going to have back pain of some nature.
What are some symptoms? If you're specifically talking about lower back and pain, what are some symptoms?
Well, pain is probably the primary symptom, but there's other symptoms, tingling, numbness down the legs. Well, the pain can vary from an aching pain to a sharp pain to a nagging, gnawing type of a pain. But the biggest concern is something that lasts for a while, or pain that's going down your leg, or any tingling, numbness down your leg, or any weakness that develops because of that. So.
Well, you and I were talking about, as we get older. Everybody else is getting older, not us, of course,
right,
but
right.
As we get older, you stand up and it kind of hurts.
Uh-huh.
And, at what point do I know that I'm past just the, it's kind of a nagging little ache, and should I seek out physical therapy or,
right.
A physician's help?
Well, I think that anything that persists for more than 7 to 10 days is worthy of being looked at by your physician, or anything that escalates or gets progressively worse over a period of time. Somebody might have an episode of back pain, it goes away, then a month later they have another episode. If it gets more frequent, the episodes get more frequent or more intense, then it's definitely time to see your physician and get referred to physical therapy. And
it can be something more, I don't know that dangerous is the word, but it could be something more than just a muscle pain.
Right.
Could there be like nerves involved, or if you have this shooting pain in your legs?
It could be a number of things. It could be muscle involvement, it could be joint involvement, it could be nerve involvement, it could be spinal cord involvement at the central level. So numerous things, and that's another reason why to see your physician to get an X-ray or MRI, or whatever they determine, and depending on your symptoms, and then be referred to physical therapy.
Well, and I would think it's something you want to catch earlier than later, so that you don't end up in a situation where maybe you need surgical.
Exactly. Yeah. I mean, like I said before, everybody's going to have some episode of lower back pain at some point in their life, usually. But it's the episodes that get progressively worse, last longer than what they should, 5 to 10 days, or get to the point where it's debilitating for them to do their job or even do their normal daily activities. Then they should seek attention.
So let's say I had some back pain, it was reoccurring, I went to my physician, he gave me that prescription, and I came to see you guys here at Indiana Physical Therapy. Mm-hmm. What might be some of the things I would expect or could expect to have done if it's a low back pain issue?
Well, we do, our therapists will do a thorough evaluation, looking at not just your lower back, but also your lower extremity biomechanics, mm-hmm. and even above the lower back, to see if there's anything that might be causing some of the problems in the lower back, and then doing a, exact assessment of your lower back to figure out what's causing the problem, if it's muscle, joint, soft tissue, or any other structures back there that could be causing problems.
So they are going to try and figure out what is making
mm-hmm.
it happen in the first place, because even if it's muscle and I fix it, if I continue doing whatever weird way I walk or sleep,
exactly.
It's just going to keep happening, isn't it?
We look at your biomechanics and your posture and everything involved. Talk with the person about their job or their other activity mm-hmm. that they like to do. Sometimes it's not necessarily just one thing, but if somebody works all day and then they go work out for 2 hours, or they go home and wrench on their car for 2 hours, that's just a lot of overload. So you have to be aware of that as well. So.
If it's not just low back pain that you guys treat at Indiana Physical Therapy, you
Correct.
can really help people with a multitude of issues, can't you?
Yes, we can. Anything from head to toe, actually. Anything that's orthopedic related, that's what we specialize in, orthopedics. Bones, soft tissue, muscles, joints. And again, in therapy, it's physical therapy. It's called that for a reason. Okay, you're going to get physical. Okay, we're going to work you. We're going to work on strengthening, flexibility, range of motion. The therapist is going to put their hands on you and work on the soft tissue mobilizations, joint mobilizations. So it's going to get physical. It has to.
It has to.
Yes, it does.
And it is Indiana Physical Therapy after all. You guys have hours that really are convenient for people who are trying
right.
to fit this into their lifestyle.
Yeah, we found that you have to be there when the people are off of work or out of school. Early in the morning times is popular time for people before work, or even right after work if it's a night shifter. And then from 3 to 6 or 7 we're very busy because of after work and after school. have to be accessible for the population.
Absolutely. Well, if you have low back pain or any other pain that you think may need physical therapy, you can get to your doctor and ask them to give you that prescription to see Indiana Physical Therapy.
Right.
You can visit their website, indianapt.com, for more information.